The autism spectrum disorder. 1% of the population of children in the U.S. ages 3 through 17 have an autism spectrum disorder. Autism is one of 5 disorders that fall under the umbrella of pervasive developmental disorders, a category of neurological disorders characterized by severe and pervasive impairment in several areas of development. According to the DSM-IV, the term PDD is not a specific diagnosis, but an umbrella term under which the specific diagnoses are defined. Autism is a spectrum disorder, and although it is defined by a certain set of behaviors, children and adults with autism can exhibit any combination of these behaviors in any degree of severity. 2 children, both with the same diagnosis, can act completely different from one another and have varying capabilities. Every person with autism is an individual, and like all individuals, has a unique personality and combination of characteristics. Individuals with autism may exhibit different kinds of traits such as tantrums, little or no eye contact, and no weird fears of danger. Characteristic behaviors of autism spectrum disorders may or may not be apparent in infancy, 18 to 24 months, but usually becomes obvious during early childhood, 24 months to 6 years. When taking your child for his or her well baby, well child visit, make sure your doctor does a developmental screening, asking questions about the baby's progress. You want to make sure your baby doesn't have the 5 red flags. Does not babble or coo by 12 months. Does not gesture, point, wave, or grasp by 12 months. Does not say single words by 16 months. Does not say 2 words, phrases on his or her own by 24 months. And has no loss of language or social skill at any age. It doesn't mean your child has autism, but should get further evaluations from a multidisciplinary team. There is no single cause for autism, but it is generally accepted that it is caused by abnormalities in brain structure or function. Other researchers are investigating the possibility that under certain conditions, a cluster of unstable genes may interfere with brain development, resulting in autism. Still, other researchers are investigating problems during pregnancy or delivery, as well as environmental factors such as viral infections, metabolic imbalances, and exposure to environmental chemicals. ARI, Defeat Autism Now, is dedicated to educating parents and clinicians regarding research, appropriate testing, and safe and effective interventions for autism. Since 1995, ARI has convened recurring meetings for carefully selected physicians, researchers, and scientists committed to finding effective treatments for autism. Their work has become known as Defeat Autism Now. Parents and clinicians who do not regard psychotropic drugs as the best or only means of treating autistic patients will welcome this chance to learn effective strategies for addressing the medical illness associated with autism. With the autistic person ages occasionally get certain symptoms. It's rather secondary to the syndrome of autism itself. Some of the related symptoms of a person with autism is Cornelia de Lange syndrome, Tourette's syndrome, and Fragile X syndrome. There are also symptomologies such as bipolar disorder and anxiety disorder. So, with this being said, children do not outgrow autism, but studies show that early diagnosis and intervention can lead to significantly improved outcomes. With the right services and supports, people with autism can live full, healthy, and meaningful lives. It is used to be thought that autism is just a fate that you accept. The good news is that there are now a wide variety of treatment options which can be helpful. So people, children, and sometimes babies, don't give up on the hope for treatment. Just take it one day at a time.